A deep-sea fisherman's preventable second heart attack. Kaimana comes from 3 generations of native Hawaiian deep-sea fishermen. His great-grandfather immigrated from Tonga in the 1890s. Today, he provides tuna, marlin, and swordfish to the local fish markets and restaurants. One day while at sea, Kaimana experienced severe chest pain while wrestling a swordfish onto his boat. When he reaches ashore, his crew drives him to the nearest emergency room. There, an electrocardiogram is performed, which showed no abnormalities. However, when his blood is tested for cardiac markers, his troponin is abnormal. Based on this result, the emergency department doctor diagnoses him with a heart attack. Kaimana is wheeled to the cardiac catheterization lab. There, an interventional cardiologist determines that Kaimana's heart attack is due to a clot in his right coronary artery. A balloon catheter is inserted into the culprit artery, and when it reaches the appropriate site, it is inflated. This is successful in compressing the underlying plaque and clearing the blockage. The catheter is withdrawn and Kaimana's blood flow through the heart is restored. He is moved to the recovery room. Just before his discharge a few days later, Kaimana's family doctor is in the room. He says that South Pacific Asians have a higher rate of cardiovascular disease than the general population, so he'll have to make changes to his diet and lifestyle. To prevent another heart attack, he will have to take clopidogrel daily, an antiplatelet drug that will prevent new blood vessel blockages. Kaimana returns to work after a month of rest. He has no issues, but then 2 months later, he suffers a second heart attack and dies at home. His doctor concludes that his antiplatelet medication was insufficient to protect him. In late 2010, David Louis is appointed as Attorney General of Hawaii by Governor Abercrombie. While in office, he investigates deaths of heart patients like Kaimana who were prescribed clopidogrel. His aides tell him that in order for this drug to work, it must first be converted to the active form by the liver after administration. However, 38 to 79% of Pacific Islanders have genetic deficiencies in the enzyme CYP2C19 and are unable to activate clopidogrel. The Attorney General initiates a lawsuit against the manufacturers of clopidogrel for the deceptive marketing and the failure to disclose this lack of efficacy towards many Hawaiians. He further argues that citizens are paying 100 times more for a drug that is no better than aspirin. It would be 10 years, but the Hawaiian courts finally ruled against the drug manufacturer, who is ordered to pay nearly $1 billion. Lab tests are available today to determine an individual's predisposition towards clopidogrel effectiveness. Those at risk need to use alternative antiplatelet medications. Stay tuned for more lab tales.